Good afternoon, dear students. So, we'll talk about the third important joint of the upper extremity today. We have talked of shoulder joint and elbow joint. Now, today we'll talk about the wrist joint. Okay. Now, by now you should know what are the points that we are going to talk of when we are going to talk about any joint. So, the first point is classification. Now, classification wise, what is the classification of wrist joint? It is a synovial joint of ellipsoidal variety. Okay, so it is a synovial joint of ellipsoidal variety. Now, ellipsoidal meaning the joint surfaces, meaning when the bones come together, the joint surfaces look like an ellipse, or it is semicircular kind of thing. Okay, ellipsoid. Okay, the next point is bones taking part. Bones taking part in the formation of wrist joint. Now, when we are going to talk about the bones that take part in the formation of the wrist joint, first thing that you should know, there is one thing that you should know and one thing that you should clearly not know. First is that the bones, that first thing that you should know is that you should know the names of the carpal bones. Here, there are two rows of carpal bones that you should know. And one thing that you should clearly keep in your mind, that ulna does not participate in the formation of the wrist joint. Okay. So when you talk about bones that take part in the formation of the wrist joint, it is lower end of the radius here like this. Then you will have the ulna which is there here. But remember, ulna is not participating. Ulna is going to be separated from the carpal bones by an articular disc. And this is called as articular disc of inferior radioulnar joint. So this is lower end of the radius. Okay. Lower end of the radius and articular disc of inferior radioulnar joint. These are going to be the superior articular surface. And the inferior articular surfaces here with the radius you will have scaphoid and lunate. Scaphoid and lunate. And here you will have triquetral and pisiform bones. Okay. So these are the bones that are going to take part in the formation of the wrist joint. So upper articular surface will be the lower end of the radius and articular disc of inferior radioulnar joint. And the lower articular surfaces will be the scaphoid, lunate, triquetral and the pisiform bone. Scaphoid and lunate are going to articulate with the lower end of the radius, and triquetral and pisiform will be here with the articular disc. Okay, and you should know the names of the other bones also, because for the ligaments you will need them. So you will have scaphoid, lunate, triquetral, pisiform as a proximal row, and trapezium, trapezoid. I am just drawing the shape is not like this. Okay, trapezium, trapezoid, capitate and hamate as the distal row. Trapezium, trapezoid, capitate and hamate. She looks too pretty, try to catch her. That is how we have to remember. And the order is from lateral to medial side. Is this clear? So these are the bones that take part in the formation of the wrist joint. Okay. Now the next point of the wrist joint is the ligaments of the wrist joint. And ligaments of the wrist joint, the three ligaments of the wrist joint are similar. Names of those three ligaments of the wrist joint are similar to the ligaments of the elbow joint. And those ligaments are, first ligament is capsular ligament. Then you will have radial collateral ligament. Radial collateral ligament. Then you will have ulnar collateral ligament. Okay. These are the three ligaments which are common to the elbow joint also. But here the attachment obviously is going to be different, but you should remember the names like this. Then you will have palmar radiocarpal ligament. Palmar radiocarpal ligament. Then you will have palmar ulnocarpal ligament. Palmar ulnocarpal ligament. And lastly, we will have dorsal radiocarpal ligament. Okay, so these are the 6 ligaments which are of the wrist joint. First is capsular ligament, then you will have radial collateral ligament, ulnar collateral ligament, palmar radiocarpal ligament, palmar ulnocarpal ligament, and dorsal radiocarpal ligament. The names itself, these ligaments, especially you will understand by the names where they are and what the attachments can be. Okay, so we'll talk about each ligament separately now. Now, the first ligament, which is the capsule, you will have this. The capsular ligament actually is attached here to the lower end of the radius. It will be attached to the articular surfaces, but there is one peculiarity. Okay, so this is the radius, this is the ulna, Here you will have the articular disc. Here you will have scaphoid, lunate, triquetral and pisiform. Now how is the capsule going to be attached? I will just show you here. There is one interesting thing. So it will be attached along the articular surface of the radius, along the margin of the scaphoid, lunate, triquetral, pisiform, and it will be attached to the inferior articular disc. But one thing is important, that this capsule has an extension into the inferior radioulnar joint. If you can make out this extension of the capsule into the inferior radioulnar joint is called as pre-styloid recess. It is called pre-styloid recess. That is what you should remember. And otherwise, the capsule is going to be attached to the articular surfaces of along the margins of the articular surface. This is one peculiarity which you should know about the capsule, that there is an extension. Meaning if the capsule is going to be like this here, there would be an extension of the capsule into the inferior radioulnar joint. This extension will be called as pre-styloid recess. Is this clear? So that is about the first ligament, that is capsular ligament. Then the other ligament which we have seen, you had radial collateral ligament and ulnar collateral ligament. Okay. Now here we will draw all the bones. So you have scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate and hamate. Okay. Now radial collateral ligament will come from this lateral side. Okay. It will attach to the styloid process of the radius, and inferiorly it will be attached to the scaphoid and trapezium. So this is how simply you can remember this. This will come from the styloid process of the radius here. Here is the styloid process of the radius, and it will go down and it will be attached to the scaphoid and trapezium. Okay. Then you will have ulnar collateral ligament which is attached to the styloid process of ulna, and it will be attached to the pisiform and the hamate bone here. Okay. So that is the ulnar collateral ligament. One on the medial side, one on the lateral side. You just have to join the carpal bones and the radius and the ulna to understand the names of this ligament. The next ligament is palmar radiocarpal ligament. Palmar radiocarpal ligament meaning it's on the palmar side, extending from the radius to the carpal bones, and palmar ulnocarpal ligament extending from the palmar side of the ulna to the carpal bones. Okay, so if you can talk of here, palmar radiocarpal ligament will extend from the lower end of the radius to the scaphoid and the lunate bones, and palmar ulnocarpal ligament will extend from the palmar surface of the ulna to the triquetral and pisiform bone. Okay, so these are the two ligaments which are going to be there anteriorly. One ligament which is going to be there posteriorly is dorsal radiocarpal ligament, which will be present here. It will extend from the posterior surface of the radius to the scaphoid, lunate and the triquetral bones. Okay, so ligament wise wrist joint becomes very easy. You just have to know the names of the carpal bones and the names of the bones that are going to take part in it, and you mention the bones and join those bones to understand the ligaments. Okay. So that is about the ligaments of the wrist joint. Next point after ligaments is what? Is the relations. Okay. Now when you talk about the relations, again the relations of the wrist joint are also very simple. Now relations of the wrist joint, if you have watched the previous video of the forearm, plan of the forearm, here this is the wrist joint here. So there will be anterior relations, posterior relations and important relations here on the lateral side. So anterior relations would be what? You will have the flexor tendons, if you remember. Except for this, you will have the flexor tendons which are going to go into the palm and to the fingers. The flexor tendons with the median nerve, and you can then enumerate the flexors which are going to be there, like flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, etc., etc. And posterior relations will be what? These extensor tendons with the radial nerve. Okay, extensor digitorum, extensor indici, extensor carpi ulnaris, extensor carpi radialis longus, all those tendons with the radial nerve. Okay, so simple. Anterior relations will be the flexor tendons with the median nerve, and posterior relations will be the extensor tendons with the anterior relations will be the flexor tendons with the median nerve, and posterior relations will be the radial nerve with the extensor tendons. And on the sides here, a very important, you will have a depression here on the side. This is called as the anatomical snuff box, which are the cephalic vein and the radial nerve in it. Okay, so those are the important relations of the wrist joint. Then you talk about the blood supply and the nerve supply. Blood supply is by the radial arteries and the ulnar arteries, which are going to be there here. The radial arteries here and the ulnar arteries here. So the branches of these arteries are going to supply the wrist joint. The nerve supply is by the median nerve, the radial nerve and the ulnar nerve. Okay. One thing you should understand, that the radial nerve is going to finish here. Finish meaning the deep branch of the radial nerve is going to finish here behind the wrist joint, and it will finish as a pseudoganglion, as a false ganglion. So it's going to supply there. So that is about the blood relations, the blood supply, the nerve supply. Then you talk about the most important point, that is the movements and muscle producing movements. Movements and muscles producing movements. Now movements of the wrist joint. First we'll try to understand the movements. First you will have flexion, extension. Then you will have here, this movement is called ulnar deviation or it is called adduction. And then you will have a movement to the lateral side which is called radial deviation or it is called adduction. And then there is a combination of these movements which is called circumduction. Now if you remember, that it's very easy to remember the muscles. Flexion will be done by whom? Flexion will be done by flexor tendons. You will have flexor carpi radialis, flexor digitorum superficialis, flexor digitorum profundus. So those flexor tendons are going to do flexion. Extension will be done by extensor tendons. Okay, so simple to understand these movements. Now this movement is interesting. Ulnar deviation or adduction is brought about by, here you can feel flexor carpi ulnaris, but on the other side you will have extensor carpi ulnaris. So extensor carpi ulnaris and flexor carpi ulnaris, both are going to be combined together and they are going to bring about this movement. This is called adduction or ulnar deviation. Similarly, on the lateral side, when there is radial deviation, it will be brought about from flexor carpi radialis, and here you will have extensor carpi radialis longus and brevis, which are going to bring about abduction. Okay, so that is about the movement, and circumduction is a combination of the movements of the wrist joint. Okay, so that is all about the wrist joint. Methodically, if you follow the pattern, it's very easy to understand. Ligaments also are very easy. Now one last part remains is applied anatomy. Applied anatomy of the wrist joint. The wrist joint is affected very frequently with arthritis, but it is not a weight bearing arthritis. It will be generally affected in people who have rheumatoid arthritis. Okay, so there will be pain and tenderness of the wrist joint, and when there is affection of the wrist joint, then there can also be affection of the median nerve here, where it can be compressed there in the carpal tunnel. Okay, and commonest applied anatomy, which is in relation to the wrist joint here. As I told you, the radial nerve ends here at the back of the wrist joint and forms a pseudoganglion. Sometimes instead of forming a pseudoganglion, there can be a true ganglion there, and some people might have a swelling here at the posterior aspect of the wrist, that is called as the ganglion of the wrist. It can be painful also sometimes. Okay, so that is about the wrist joint. I hope you have liked the video. Please watch the video carefully, understand the points, and like, share and subscribe to my channel. Thank you.